guys, welcome back to my YouTube channel. My name is Na Odalukoshi Adoma, and today we are going to talk about mental health care, where to seek professional care, and I repeat because the professional care in there is very important to me. So in the past we've spoken about how to some myths about mental health, how to spot the signs of mental distress, and what to do when you notice somebody is in mental distress. And today is going to be the concluding part of that series. We are going to talk about where to seek mental health care right here in Ghana. Please make sure to like and then subscribe to my channel, and then we'll get into the details of it. So do that right now. If you have been watching my video, you've noticed that I would state that this video does not constitute professional or psychological advice, and that you should seek professional help in times of dilemma. What this topic is about, where to seek professional help. We are going to talk about where to go, the resources that are available to you. Those are the ones that we are going to talk about today. In Ghana, when there's sign of mental distress, like when you notice that a family member, a friend, or somebody is in mental distress, showing signs of mental illness, delusion, depression, any signs of it, our first point of call most of the time is traditional healers, religious leaders, and herbalists, and other sorts of spiritual connotations to it. This is because we believe most of the time that the disease or the illness is spiritual, and most of the time I've heard people say that as a payment of a wrongdoing. So when somebody goes mad, they will say, oh, this person did this, and then went to chase somebody's husband or went to chase somebody's wife as a punishment to wrongdoings. Yes, so that is what we usually do. And I am not disputing any of these avenues because I'm not in the capacity to do so. But from what I know, some of these interventions can be very unfortunate. It involves beatings, chaining, starvation, a whole lot of things that are inhumane to the sufferer or the patient, and that sometimes make the patient's case worse than it could have been. Okay, so these are the reasons why we need to know the right avenue and the professional avenues to take people to where they receive the care that they actually need. And this is the job of psychiatrists and psychologists. And there are also psychiatric nurses that are trained in this capacity to do this work. So there are two main types of mental health treatment available, and that is the psychiatric, which is the medical field. That is those that are trained as medical doctors, and they give medication, therapy, and a host of others. And then there's the psychologist or the talk therapist or the psychotherapist, and then they do therapy for the patients. They talk through them, they manage them, they help them with like talking to them, explaining things to them, and then also listening to them vent. Basically, that is, and then the difference is that a psychiatrist can prescribe medication, but a psychologist cannot. But both of them are important, and sometimes they work hand in hand with the medication and then the therapy to get the patient where they need to be. So first of all, there are medical facilities all around the country that we know, and then there are psychiatric units in most of the major hospitals in Ghana. So they are there. And then in the rural areas where there are no major hospitals, you would find psychiatric nurses that are trained in the field to provide help. And then there are also other NGOs that have facilities that provide medical help for patients. So it's not like there are no resources. There are. Probably they are not sufficient, or yes, but it is there, and it is in your best interest to use it because it is a way better option than others that have been used in the past. And so let's go into some reasons why people would not go into the facilities that have been provided. Accra Psychiatric Hospital is there. I think everybody in Accra knows Accra Psychiatric Hospital, and in its name you know what is done there. So that is like the first option for people within Accra. If you don't know anything at all, you know there's a hospital called Accra Psychiatric Hospital, and it's your option. But then people will not go into hospitals. The first thing would be ignorance, that they don't know anything else. For them, anything goes to a traditional leader, a spiritual leader, a herbalist. That is what they know. So especially in the rural areas where they don't even access to a professional doctor for malaria and other stuff, and most of their illnesses go to the traditional healer. Of course, then that would be their first option. And for those people, it is a matter of ignorance. They don't know and they do what they know. And that's understandable. And it's the responsibility of the government to make sure that there's accessibility for all. And then the other one would be stigma. I know people, I have experienced people that live in a dying fear of being seen anywhere around the Accra Psychiatric Hospital. Because being around that place gives you a tag. It gives you a tag, and the mental illness is heavily stigmatized around here in Ghana. So then nobody wants to be associated with it. So even though the person in desperate need of help, the person would not be seen around such facilities. And that is one reason why the person would go to a trusted religious leader or an obscure traditional healer, anywhere to get their problem solved without broadcasting it out. And that is basically what it feels like if you would have to go to the hospitals where you meet a whole lot of people. And so that's another one of the reasons why people will not use the health facilities. Another one is logistical inaccessibility. Imagine somebody living in a village and then the next hospital is almost 5 hours away. Such a person would opt for what is available to them. And that is also understandable, but it is not ideal and it is not the best thing to do. And then my favorite, this is the one I want to talk about the most. People don't go to such hospitals because they are worried about costs and expense. And I wish to tell you right now, that seeking for psychiatric help in the government hospitals is actually not expensive. If you can afford to go to hospitals for malaria, pregnancy, and any other thing, you can afford to seek professional help for a mental health condition. It is not expensive when you go to the hospitals. What would be expensive or considered relatively expensive would be seeking a private healthcare or therapy. And therapy in itself is not that expensive. They charge very, very conveniently. What I do know though is that a lot of people would not pay for talk therapy. A lot of people do not see the essence of it, like going to a psychologist. We used to say that seeing a psychologist was a rich man thing or white people thing, and then black people don't do that. Well, that tells you a lot about how our society is structured. Talk therapy works. Psychotherapy works. The use of psychological treatment works. It's even been shown in a study. I read a paper, and I can find a paper for you, that says that psychological treatment can sometimes be more effective than medication. And so if you have access to it, please use the psychologist for your treatments. Okay, and then I'll go into the last one, which is myth. I think we had a video on myths before, but I didn't cover this. The myth, one of them is that when you go into a hospital, you'll be restrained and you'll be put in the bed and you'll be tied up, because we see a lot of those in movies, or even in our other traditional setups. The people are confined, they are tied in chains, and then they are put in restraints. It is not true. Another myth that we also need to dispute is that people that get mentally ill will never recover. Because of that, some people would not bother to spend the money or the time in seeking help, because then they write the people off. This is also not true. People that suffer psychological illness, I believe all forms of psychological illness can be controlled with medication, and sometimes even eradicated entirely, with the person recovering up to 100%. and then the treatment work. And no, you are not put under restraints just for going into the medical facility. There are a lot of OPD patients. People go in and come every day. I have been to across psychiatric hospital several times. You see people come in, they see the doctor, they take their medication, they go. Just like you go to the OPD in the polyclinics, the clinics, and in the hospitals. It's basically the same. They just come, they talk to the doctor, tell them their symptoms, whatever they've experienced. Some people even just come for reviews, tell the doctor how their medication is working for them, how they feel. They take their medication, and then they go back home. There is no restraint. There are people that need to be put under restraints. That is a different case. That has nothing to do with the whole mental health disorder issue. It is like somebody who has a kidney infection going under dialysis. It's a special case. It doesn't really apply to everybody. I hope this is clear. Okay, so now what I want to go back to talk about is the mental health issue with costs. One thing I have noticed is that we do not want to pay for such services. Since I started this video, I've had a few people reach out to me that they want to seek help, and I have directed them to a few societies and NGOs that provide these services. But it seems like people do not want to pay for such services. Think about it. These people are professionals. They have been trained. They've gone to school. Most of them have master's degrees, PhDs. A doctorate degree for a psychiatrist, basics of it is like 6 years in school. That all costs money, and they deserve to be paid for their work. So it is important that we normalize paying for medical health care. Just as you would pay for malaria, pay for your sanity, because if you lose it, you lose a lot more. Okay, so let's get into the details of where to seek professional help. Where do you go when you notice that your friend, your family member, or even yourself is feeling off and then you would need to see someone? So the first thing is easy, straightforward. Go to your general practitioner. Go to whichever hospital or whichever clinic you've been going to. And when you see the doctor, you tell the doctor, this is what is happening to me, to my friend, my family member, and I believe we need to seek psychiatric help. Or sometimes you don't even need to suggest the psychiatric help yourself. Once you explain your symptoms and the signs, they would be able to identify and direct you to the right place to go. And then the second one would be to walk into any psychiatric hospital. There are several psychiatric hospitals, both private and then the government one. Accra Psychiatric Hospital is there right there in at Asylum Down, they call it. It's at Adabraka. You walk in, go to the OPD, ask, and you'll be directed. It is not expensive. It is affordable for the average Ghanaian to seek medical care. The third one will be to contact a private practitioner. There are psychologists and psychiatrists that would see you in the comfort of your home, or you go to their office and then talk to them. Those ones are private practitioners. You can locate some and then call them. And then you also join a forum. There are forums of people suffering from mental health disorder. So there are people that have a forum for bipolar sufferers, schizophrenia sufferers, and it is sometimes it helps. It helps to have people around you that understand you, because having mental health disorder itself is like having a shift away from regular people, and then they do not understand what you're going through. So joining forums gives you resources of professionals to take care of you without the expenditure of individual attention. So join a forum, ask around, find a forum you feel comfortable with, people you would identify with, and then join them. Also, there are a lot of other resources online. There are associations and NGOs that would provide help for you, and then I would include the links to some of these resources in my comment section so you can look at them. You can always check PsychAid and Love on Facebook. There's Psychosocial Africa. You can check the Association of Ghana Association of Psychologists and Psychiatric Health. And then all of those resources are there for you to check. But I will include their Facebook links as I have seen them. And then I've also interacted with some other people that are willing to help. So I'll include all of those links. Please, please, please seek help. When you have mental health cases, they do recover, and they can recover 100%. So seeking help and then medical attention is not a waste of time. You are not going to be restrained and then kept under lock and chain when you go to the hospital. That is a myth. It is not true. So please seek help. And then please pay for medical health care. Just think about it, that the professionals that are caring for you, they have families, they have needs, and then they also need to pay. They had trained. Of course, it's very, very expensive to train for some of these things. So please be ready to pay for their help. And then finally, mental health diseases are not always spiritual. They are just illnesses. They are just as bad an illness as diabetes, hypertension, cancer. Every other illness, that is not necessarily spiritual. This one is also not. So yes, go out there and seek help. Speak to your GP. Walk into any psychiatric hospital. Contact a private practitioner, and also join the forum. And then I'll put the links of all the resources I have available in the video at the end of the video, so you can locate them and interact with them. All right, so this is the end of our series, and then we'll get back to you with more interesting videos. Thanks for sticking with me. And then if you've not watched any of my previous videos, please look for Bold and Gold, subscribe, and then check out all of our videos, and it will benefit you. Mental health is you. It is your life, and if you lose your sanity, you lose a whole lot. Do not lose it. Get help. Treatment works. And thank you so much for staying with me. Bye-bye.